communicable diseases, especially diabetes, is eating up the budget of the Queen Elizabeth Hospital. Chief Executive Officer Dr. Dexter James says that's what a recent study has revealed. It was done at the QEH over a 48-hour period and focused on diabetics receiving care at the hospital. He says the situation could continue to drive up the cost of healthcare in Barbados and is putting increasing strain on the QEH's finances.
What the study found was that in an analysis of 261 beds, 111 of those beds were occupied with patients with diabetes. So 42.5% of the cohort of patients reviewed by charts were diabetics. And it is reflected as the highest documented in the English medical literature, 42.5%.
The issue was one of several raised during the second QEH Healthcare Financing Conference, which is on at the Lloyd Erskine Sandiford Center today. There, the CEO also revealed that many diabetics are simply now spending too long at the hospital, taking up most of the bed space. According to him, it's partially responsible for long waits experienced by patients in the accident and emergency department.
For the most part, these patients lie on a bed with diet, medication, bed rest, for the most part, until the diabetic condition improves, and then they discharge. 19 days when we're supposed to be moving towards ambulatory care to minimize occupancy levels, and we have a cohort of patients, 42% spending 19 days on our beds. So it explains when patients come to A&E, all the diagnostics are done, we need to find a medical bed, and the patient remains in A&E for sometimes a day or two, waiting for a bed. This is one of the phenomena that is driving the challenge relating to bed management.
The Congress of Trade Unions and Staff Associations of Barbados, although losing the Barbados Workers' Union, says it is here to stay. Its president, Cedric Murrell, says despite some challenges, the past 2 years has been a period of mixed fortunes. His comments came as he delivered the president's address at the 10th Biennial Delegates Meeting at NUPW headquarters this morning. Mr. Murrell also declared that the social partnership, which the BWU withdrew from, is a model which has served Barbados well.
Barbados has promulgated a unique model of a social partnership to the world, and it would be senseless for the labor movement, which was the primary champion of it, to sit idly by and watch it being threatened or compromised without developing a plan of action to address the situation.
Mr. Murrell says government's retrenchment exercise has left a bitter taste in labor's mouth, and the movement is concerned about economic growth. The C2SAB head wants Barbados to give serious consideration to having a labor representative among its delegation at key CARICOM meetings.
C2SAB is currently represented on the CARICOM Commission on the Economy as part of the Barbados delegation, on the National Tourism Host Program Task Force, and on the National Task Force on Business Facilitation and Trade. There can be no good reason why Labour could not be invited to participate in the meetings of the heads of government as a part of the Barbados delegation, where wide-ranging matters that include regional economy, regional trade, and tourism are discussed.
Labour Minister Senator Esther Bayersuku also addressed the opening of the delegates as local workplaces have been made much safer through legislation such as the Safety and Health at Work Act and the Sexual Harassment Bill. Dr. Bayersuku believes that workers who feel protected are more likely to be engaged and productive.
Ensuring that our workforce knows what constitutes healthy behavior, fostering motivation in our people, and ensuring that they have the skills and supportive infrastructure they need to improve their behaviors. Our policies and programs aim to positively influence employee health promotion and protection. And I would wish to encourage our employers to give any new rules or mandates an opportunity to work.
Senator Bayersuku is encouraging employers to continue investing in their employees' health and well-being.
I like the one that NICE recently did, about 1 million steps in 100 days. That's equal to the recommended 10,000 steps a day. Days for bringing only healthy lunch and snacks to work. Days without soft drinks, a bugbear of mine. Days without soft drinks. Days for not using the elevator, unless, of course, you can't get up the stairs because of a bum knee or something like that. Exercise classes, in-house recipe challenges and demos, rewards such as gym memberships instead of dinners. The possibilities are endless.
And President of the Healthy Caribbean Coalition, Professor Sir Trevor Hassel, called on C2SAB to be an advocate and let its voice be heard on issues that can impact on the health of the nation. He reminded the association that it too has a role to play in the fight against non-communicable diseases,
in which C2SAB comes together with the other sectors of the society, that is, the business community and government, even as C2SAB itself undertakes its own specific actions for its workers. This is an approach that has been strongly endorsed by heads of government of CARICOM and internationally, for there is universal agreement that a multi-sector, collaborative, whole of society and whole of government approach is required to effectively respond to the epidemic of NCDs.
The time for talking has long passed, and a concerted effort is needed now to help children who are failing academically. This from President of the National Union of Public Workers, Walter Maloney, who says that organization is leading the charge with the launch of the NUPW Education Outreach Schools Project, or NEOS. Mr. Maloney says the union has traditionally been an agent for change, and this situation is no different. He explains that the program caters to children of members and will be in two phases. The first is a free service focusing on the 11+ and getting children to read. The second involves an academy called Second Chances, which will be set up for young people who have left school without any qualification. A fee will be charged for the services. Mr. Maloney stresses that the nation's children must be protected.
I'm not a sociologist, but I believe that there's a linkage between those children and the level of violence and deviancy they're becoming to get involved in. The fact that they cannot think rationally, they're not thinking logically, the fact that they cannot read, these are reactions to a certain set of stimuli that it is not what we will do because we are not placed in that position. But those children can find themselves easily swayed by other persons because they are not thinking for themselves. And we have a responsibility to make certain that we curb that.
And Principal of the Parkinson Secondary School, Jeff Brooms, who is part of the steering committee for both programs, says during the last 5 years, 60% of students left that institution without a single CXC.
There are quite a few children who leave school, and there are a number of schools, it's going to get worse, by the way, let me clear about this. There are a number of schools right now who do not give children a second year in fifth form. So if you don't meet it now, you go. And that's going to, the number of schools doing that will increase. And that will therefore suggest is a challenge to us as a society. What are we going to do with these 16-year-olds and 17-year-olds who have no certification or only have one or two, and on the they are immediately drawn to the block. They're immediately drawn to lots of distractions and stuff that are not profitable for developing society.
The NEOS program starts on October 18th and runs for 8 weeks, ending December 13th. It resumes on January 10th and continues up to Common Entrance. All classes will be held at the NUPW's Dalkeith headquarters. Over the last 10 years, the number of elderly people with dementia in Barbados has doubled. Gerontologist Dr. Ambrose Ramsey says there are about 4,000 people living with dementia. He was speaking at a panel discussion organized for World Alzheimer's Month. Between 2004 and 2005, just over 15% of the admissions to the geriatric hospital were diagnosed with dementia. He adds that as those numbers grow, it is putting pressure on the health system.
The referral diagnosis was dementia for 16% back in 2004-2005. Between 2008 and 2011, that average percentage increased to 32%. So the demand for long-term care by persons with dementia is increasing in Barbados. In 2008, a survey of the residents of the long-term care facility, the geriatric hospital, at that time we had about 340 patients, and 54% of that population were suffering with dementia.
6 Cape Shepherd customers have been rewarded for their loyalty to the store. They were selected for a number of prizes after using their Cape Shepherd cards or spending cash in the store as they prepare to send their children back to school. They were required to spend at least $200 to qualify. Card competition grand prize winner Seisha Waterman and cash prize winner Akila Archer both say they are excited about their win.
I got a call. I actually missed the call twice, so I called back later in the day. The lady asked me some questions and I was querying why she was asking those questions, and finally she told me that I was the grand prize winner.
In that moment when you found out you were the grand prize winner,
I was ecstatic. I was over the moon. I had never won anything before. This was my first time winning anything like this, and therefore I couldn't have been more joyful.
I came shopping for my kids back to school books, and I got a call last week Friday that I actually was entered in the competition and won something electronical. So all of my home jumping up. So I'm very grateful, and I don't have a problem with shopping with Cape Shepherd. I always did, always will continue to, and I'm quite happy. First time winning anything.
A manager of card services, Alison Brown Ellis, says it's part of Cape Shepherd's efforts to give back to customers.
We know that they have options in terms of where to shop for back to school. We spend a lot of time and effort to really build a campaign that is attractive enough. We extend that promotion to our sponsors. Some of them may be our merchant partners, but generally we look to see what is attractive that we can incorporate into our promotion so that we're building an exciting promotion.
Well, it appears as though Dion Anderson David Norville cannot ignore the lure of sea eggs. Just 2 weeks after he and 2 other men were fined by the court for possession of the delicacy, the 23-year-old Martins Bay St. John resident was arrested again. Norville was held with a bag of sea eggs during a police operation in Martins Bay. He is to appear in the District C Magistrates Court today. Now, on September 11th, Norville was fined $1,000 with an alternative of 3 months at Dawes if he did not pay.